Well, as the number of coronavirus infections keeps soaring, yet another challenge is in the offing. The Kenya National Union of Nurses now says it will rally its members to a nationwide strike effective August 10th if the government fails to meet its end of the bargain on compensation and protection of frontline medical workers. And as our health reporter Eunice Omolo now tells us, a strike may make an already bad situation much worse.
The Kenya National Union of Nurses is accusing the government of failing to hold its end of the bargain by not paying risk and other allowances to its members. And in the face of the health crisis presently before the world, Secretary General Seth Panyako says the nurses deserve more for being on the front lines.
The Senate should put in mind that nurses are demanding a risk allowance of Kenya shillings 20,000 to be introduced in their pay slips permanently. That we together with all health workers and other county public servants will bring this country to her knees on Monday, the 10th of August 2020, if these issues are not addressed.
But that's not all. The Kenya Medical Association says medical practitioners deserve a proper insurance policy for its staff, as well as prompt compensation in the event that one contracts or dies from the virus. So far, over 500 medical workers in different cadres have tested positive for the coronavirus, and a number of them dead.
The issue of compensation and insurance in case a doctor or a nurse or the other key workers actually lose their life while providing service. You know, just the other day we lost one of our colleagues, and you see these children that you are leaving behind, the family and those dependents, we need to have a robust insurance scheme to actually protect the healthcare workers in case of demise in the line of duty. And this is something that has been implemented in the other essential workers. I know in the army, in the police force, this is done. And I think it's time we really sit down and implement that for the healthcare workers, so that we can have, we go working knowing that you're giving our all for our country. But in case, in an unfortunate case, we lose our lives, then we know that the people we have left behind then will be taken care of by the government.
We demand with immediate effect the reinstatement of National Health Insurance Comprehensive Civil Servant Medical Scheme that we have been told it has been stopped.
The Kenya Medical Association also says safety and remuneration concerns are affecting the productivity of medics.
It affected the morale of healthcare workers because you are there serving the public, but you're not able to actually take care of your family back at home. And in instances where some counties are lacking quality PPEs, then you have to procure them, and they're very expensive for you to protect yourself and protect your family. So I think we're going to have a meeting with the different stakeholders and the government, Council of Governors, to ensure that these workers who are actually our frontline soldiers are well taken care of.
There is no denying that a strike at this time will paralyze operations in public medical facilities, already reeling from the soaring number of infections. Eunice Omolo, NTV.